Okay, all right, great. I'd like to call the Budget and Public Employees Committee meeting to order. Madam Clerk, please call the roll.
Alderwoman Boyd, Alderman Oldenburg, Alderwoman Velasquez,
Present.
Alderwoman Sanier, Alderman Aldrich,
Present.
Chair Spencer,
Present.
Alderwoman Boyd, Alderman Oldenburg, Alderwoman Sanier. We have 3 present.
Thank you, Madam Clerk. Let's see, I'd like to, we have no approval of the minutes. We did have one item here. Let's see. The only item we're going to be discussing today is Board Bill number 1. We have our Health Department here, Dr. Motti, to present the budget of the Health Department. Dr. Motti, for any of your staff, I recognize that you have some staff members here. We are swearing everyone in, including staff members. And so if you don't mind, maybe you could introduce yourself, your staff, and then you're welcome to present your budget. Thank you for being here today, and thank you for accommodating our tardiness and getting started.
The next week.
Yeah, you might want to press the button here. Sorry about that. Just a reminder, we'll.
The rules says you may, so if you don't want to.
Really?
It's up to you.
Okay.
Red. Now.
Oh, still.
Okay. Hello. Okay.
Good morning.
Good morning, everyone. My name is Dr. Mati Hlachwayo Davis. I'm the Director of Health for the St. Louis. I'm so pleased to introduce the members of my team who are here today. First, Emmanuel Kani, who is the Fiscal Bureau Chief for the Department of Health. And second, Kimberly Vandenberg, Supervisor for our Communications Section.
Thank you, Dr. Motti. And I guess we will ask you to all raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
We do. I do.
Okay, thank you. Thank you. You may proceed.
We have prepared some slides for the budget, the Department of Health FY25 budget presentation. That is on the screen. We've also prepared packets for you to be able to follow along. So let us get started. Next slide, please. So the Department of Health fiscal year budgets from year 2022 to year 2024 will be the first slide that I present to you for global perspective. The actual budget in 2023 was $30.1 million. The budgeted amount for 2024 was $33.2 million, and the proposed amount for 2025 is $35.7 million. Next slide. And taking a little bit of a closer look as to how this breaks down in our department, here we'll be showing you comparison of the Department of Health general funding versus grant funds. For fiscal year 2023, the department's general funding was only slightly over the department's grant funding. General funding being nearly $16.7 million, grant funds accounting for $16.5 million. In fiscal year 2025, the budget will receive slightly less. In general funding, nearly $19.7 million, and in grant funds, $16 million. So if you look at our FY25 priorities, just to provide you with that global perspective, first and foremost is a new animal care and control shelter building. As many of you have heard throughout the year, the current space for animal care and control is inadequate for employees, for veterinary care. The reception area space for adoption procedure is limited. There is very, very significantly limited outdoor space for enrichment, storage, and really globally all around. Additionally, we have built, under my leadership in the last 2.5 years, our animal care and control, we've quadrupled the size of animal care and control, so we are responding to more. We just have way more animals that we need to account for, and the building is insufficient. So our priority that we've been working with the mayor's office, Nancy Cross, is really championing this effort on our behalf, are working with us on a new animal care and control shelter building. Our second priority is to build over the next couple of years an Office of Strategy, Quality Management. And so the first step this year is trying to reorganize staff to strategize towards building and reviving a Department of Health to fully and equitably meet the health needs of residents. This is a really important one that I think goes over people's heads easily. We spent a lot of time in a global pandemic, and the whole health department literally had to become about this singular focus. But it's really it's critical for us to understand that a health department foundationally serves so much across the spectrum of health and public health, and we need to rebuild that and have infrastructure available for that to happen. So that has been and will continue to be something you will see me come back for year after year after year after year until I believe we are where we need to be. And the mayor's office, again, has heard this from me and has been working with me to make those steps towards building something, because you can't build something that hasn't been prioritized for over a decade overnight. So I'm grateful for the leadership and partnership of Mayor Jones. The last priority is really internal investment. We're focused on dedicated personnel for diversity, equity, inclusion, and health equity initiatives, as well as for employee education and engagement. In my first year, I implemented a department-wide survey for employee satisfaction. I do that survey every year, and that's a way to keep myself and my executive leadership accountable to how we're truly running the department. It was clear from the department they just really lack an internal investment. Not many opportunities for their growth, for their orientation, for their training. People get promoted from within and are just expected to know how to take on these positions. And so we have really dedicated this year to providing support to staff, and very excited by the opportunities that the Department of Personnel and the Mayor's Office have made available towards training our staff. So that's very briefly some of the priorities that we are focused on. In looking at the 24 to 25 changes to make evaluating health's budget easier for you, these are the main areas that you will see a difference in our budget from last year. The first is, again, a conversation that many of you have been engaged in, and that is oversight of CJC medical operations. Due to Mayor Jones's leadership, we have seen for the first time a mayor come in and say that the health department, and specifically the director of health, should have a key role in the oversight and evaluation of medical services within CJC. And so in FY24, DOH began that oversight on December 1st with a few months of pre-planning prior to the December 1st start, with a transfer that the mayor's office committed to us of $2 million. Funds were reallocated from the Division of Corrections, and those funds support full-time employees and operational funds for medical oversight. One of the things I've really advocated for as part of this new venture is making sure that we operated at the highest standards, and in so doing, I reached out to the National Commission on Correctional Healthcare, NCCHC. This is the body that is responsible for the standards and the accreditation of medical care in correctional facilities throughout the country. I'm pleased to report that they have started an 8-month contract with us on May 1st, and that is a significant portion of the budget that was afforded to us by the mayor's office. In FY25, we have created an inmate medical program section. So you will read that as 700,019 in the budget. And again, this is what is dedicated to clinically licensed staff and other programmatic staff to oversee the contracted healthcare provider, PCUSA, but who may also perform clinical services as needed as this progresses. So those are that is the main change from FY24 to FY25. You'll be seeing that new addition. So this slide is just to orient you to how the budget is divided amongst the different bureaus. We have 8 bureaus within the Department of Health, and they are split between administrative and programmatic bureaus. So 25% of our budget comes from the Healthcare Trust. The Director of Health and Hospitals accounts for 16%. Our Communicable Diseases Bureau accounts for 13%. Environmental Health, 12%, Animal Care and Control, 11%. The Inmate Medical now accounts for 10% of the budget. Family, Community, and School Health, 7%, and the Health Commissioner's budget will account for 5% in the coming year. I will now walk you through the different aspects of those budgets and give you a little bit of a granular idea of what is happening here. So the main focus of the director's budget, 110,700, is really reorganizing the table of organization in a way that makes sense to support the priorities that I presented to you. We moved positions from 700 to the new inmate medical, and the strategic planning and quality improvement have been allocated to the newly reestablished Health Commission. You rarely see or hear the Commissioner of Health for the City of St. Louis, but I'd like to give her her flowers while I'm here. I often get to come and get lauded and be supported by you, but I have a Commissioner of Health in Victoria and Worry who has been absolutely instrumental and a champion for a lot of the positive changes that you see within the health department. It only makes sense that a lot of the passion and the innovation that she has brought is rewarded by her own individual leadership. And so you will now see a line item in the budget committed to her, the Health Commission. And this Health Commissioner's section of our budget will provide the foundation and direction for reimagining and building that public health department for the 21st century coming out of COVID with a focus on strategy, on quality, and on evaluation. In moving along to the next part of the budget, the Healthcare Trust. So the Behavioral Health Bureau comprises most of the healthcare trust that has been embedded in the charter for many years. And as you all know, the Behavioral Health Bureau is an innovative bureau that under my leadership we brought to the city after my first year. This was a big priority of Mayor Jones. When she interviewed me, she made clear that mental health and substance abuse was really something that she wanted to see us address, and supported me in the first year in bringing a behavioral health bureau to the city. Because of how well they have hit the ground running, many of you have met with their fearless leader, Dr. Julie Gary. We are moving forward in increasing awareness of services through a few pivotal campaigns. Number one, we are increasing our visibility through communications campaigns. We are making plans to really supplement and augment the website for better accessibility. And we are trying to champion a citizen-focused phone application as well. Some additional goals for the Bureau include 5 linkages to care and criminal justice a week. So one thing I've really tried to implement in the last year is focused key metrics and key performance indicators for each of the bureaus. And so they really push them to make these goals for themselves so that we can meet them and exceed them as we have done in the past. The Transitional Recovery Housing and Wraparound Collaborative Project with federal, state, and local community partners is something I'm very excited about. Federal leadership from SAMHSA is working with us in the city of St. Louis in a new championed effort around really bringing social and structural determinants of health into the behavioral health space. And so our focus here will be really working on transitional recovery housing and some of these other wraparound services. We are also, through this budget, going to provide support to focus on strategy and quality improvement on the Office of Strategy, Quality, and Health Equity. In focusing on the priorities for the communicable diseases section, this is the bureau that's had the greatest challenge acclimating after COVID-19. If you aren't as familiar with communicable disease, this is where the traditional work of public health is, case investigation, and this is where all of the work of COVID, investigating, educating, and reaching out in community was. So they've really been rebuilding, and I couldn't be more proud of them. So one of their first priorities in this FY25 year will be to engage with and provide technical assistance to community institutions regarding seasonal infection transmission and prevention. I can't even tell you, I can give you a number of examples just in the last 3 weeks of how their work is so pivotal. You've read about maybe a scabies concern in a school most recently that the Department of Health has been taking the lead on, a TB case at another school. We've seen pertussis on the rise. Coming out of COVID, you are now seeing the emergence of so many infectious diseases agents across the country. So this work will be even more important because people had really become accustomed to focusing on the singular infectious agent. And now, as nature does, as virology and infectious diseases do, we are seeing the emergence in a lot of case investigations coming out representing the spectrum of infectious diseases. And so that technical support, providing templated and structured ways to interact with us, to get the education. We're having town halls in schools. We're providing letters and information to the community to help them not have, quite frankly, what feels like a little bit of a hangover from COVID, where everything feels like it's and we need to help the public to really be able to place what's happening. As a regional lead agency, we're expanding condom distribution with HIV, STI testing programs. If you haven't been paying attention, STIs and especially syphilis are a national crisis, and the city is no less. And the last priority is to broaden tuberculosis awareness and education through screening clinics for high school seniors entering the healthcare workforce, unhoused residents, health fairs, and most importantly, with our migrant and immigrant communities. People really underestimate how tuberculosis care and screening is a foundational aspect of our community members in the migrant and immigrant communities when they first come to this country. Moving on to animal care and control, you heard me talk about this being probably one of the biggest priorities we have. And so the other priorities that I did not speak to outside of the shelter are to modernize and expand vehicle fleet to replace the aging trucks. The safety of my officers, the safety of animals that we are taking is critical, and them being in fleets that are not in a position to support them is unacceptable. And I'm very thankful that there are interdepartmental relationships that are really taking this seriously and working with us to modernize and expand our vehicle fleet to support the significant growth of this section. We also talked about the shelter. We're going to consolidate after-hour contacts to a single hotline to help streamline the PD dispatch and animal control coordination. So really make it easier for folks in the community to let us know when they need help and to communicate that to us in a timely fashion. Lastly, the priority for next year is to equip new officers with standardized equipment for safety and productivity. These things include armor leash poles, bite gloves, microchip scanners, and uniform. Again, the safety of these officers must be a priority. In moving to the rest of Environmental Health Bureau's priority, we're working to establish and to support online and in-person digital payments for food and beverage permits. Many of you hear about the barriers that small business owners and people have in trying to coordinate either for events or for their businesses. Part of that has been the city being paper for as long as we can remember. Again, it has been refreshing in the last couple of years to see Mayor Jones prioritize this, to see us now go paperless. And within the Department of Health, we are moving that forward too. I really want to credit Cindy Reardon and ITSA, who have worked tirelessly to bring modernization from the data space and applications to support the work of our food and beverage inspectors. We are modernizing record keeping by transitioning to a digital storage system. We want to increase the number of filled environmental health officer positions, and we want to identify professional development opportunities to assist with the retaining of current, seasoned, and knowledgeable staff. I think we talk too little about retention efforts, and that's going to be a big part of our work in the Department of Health. We've grown by over 35% in 2.5 years in an environment that has a significantly high turnover, but we don't want to waste that growth. We want to focus on retention. In moving to family, school, and children's health, which will be my last slide before I open it up to questions. Again, if you have been living under a rock, hear me when I say this, maternal child health is and must be a foundational priority of public health. Missouri has constantly been, over the last decades, in the bottom 10 states in the country earning in the last year a D- grade by national standards. And so we have been really working to provide a strategic plan around maternal child health. I'm really proud of the national acclaim that we have received, National Medical Association coming to St. Louis and sponsoring Departments of Health Maternal Child Health event, HRSA coming to the city as well, and leaning into our leadership to provide them with feedback around this critical issue. So what will we be doing in the city? In FY25, the first is providing pregnancy exams for early detection and proper prenatal planning to over 100 women of childbearing age. In 2024, I had our entire bureau trained in doula training, and we will be implementing the first doula program within the Department of Health's history in FY25. We will be coordinating those doula services to ensure a healthy and optimal pregnancy outcome for our first goal is 25 women of childbearing age. Other priorities for this section is to provide case management services to over 1,000 children with blood-lead poisoning, accomplish 5 healthy home inspections to provide awareness and resources for asthma triggers and blood contaminants in the home. We want to provide over 20,000 vaccinations through partnerships for school-age children to increase immunization rates. It has been really disappointing to see immunization rates for children decrease post-COVID across the country. We're seeing measles outbreaks, whooping cough, things that children do not get at the rates that we have been seeing them recently. I am fine with adults making their own informed decisions about what they want to do for their own health. I have zero tolerance when that affects children who cannot advocate for themselves. So this will be a big part of our focus in FY25. We will be supporting 500 women with breast cancer case management follow-up. And lastly, our goal is to administer men's health presentations and provide resources to over 100 men. I will stop now and happy to take any questions.
Thank you, Dr. Mahdi. I'll turn it over to the committee for questions. Did you want to go over the actual budget, like the items? Increase the additional, I think 16 to 19 million, in your budget. It might be helpful to kind of just run through what that looks like.
Sure.
If you would like us to turn to a specific
Website version?
page in the line item detail, or is there some from
So I'm happy we can take you to, visually what you're going to see is the budget that we received back from Paul Payne's office, and I can just walk you through the different divisions very briefly.
That would be great.
So in general, the budget decreased very slightly by $1 million. The trust, which is the section that we get $5 million through a tax in the city, remains static at $5 million. And as you heard me discuss, that will be primarily for behavioral health purposes. Communicable disease section, which you heard me just speak about, just giving Kim a chance to pull.
So, Dr. Mahdi, if we're looking at the line item, page 339 is where the Commissioner of Health starts, right? 327.
Can you take it down? It's still this way.
Dr. Mahdi, if you wanted to glance in the book, we have one sitting there for you.
Here, thank you. That will make it much easier.
It's just sometimes helpful to be kind of looking at the same numbers.
Is it page
327,
197? Do you
right
want to
here.
see 197?
No, it's fine. I can work from here. Yeah, 327. Yeah. I can work from here. Okay. I don't know how you see it, so I'm going to start with health and hospitals, budget by division. Is that what you're seeing?
Yes.
And it's going through the line items? Yeah, so you'll see it on the screen. I'm just going to start talking through it if that's okay. So on the first page, you will see that the budget for FY24 came in at $16,669,908. The proposed FY25 budget for general and local use taxes is coming in at $19,639 and $907.
Sorry, where are we looking at, Dr. Mahdi?
Sorry, I can't see what you can see. So in this book, if this is the book y'all are using? Yep,
Yep.
so page 327 in this book.
It doesn't say those numbers, that's why I agree. This is just the use tax fund, which makes it a little bit confusing.
Okay, let me start with just the overall numbers, and you'll hear what I'm about to walk you through in a second. So that's how what you're going to see now is personnel, services, right? We requested 3 million for personnel for the Department of Health, for the overall bureau, for the overall department, and what was returned to us was 2,221,000. Is that? You're seeing it? Okay. And 646. How that translated was about 11 out of the 31 proposed new positions that we proposed. Our budget has stayed stable around our requests for materials and supplies, stable around our requests for, has increased from FY24 to FY25 around materials and supplies, decreased by half for rental and non-capital leases, and then for non-capital equipment, has increased significantly from 8,700 in FY24 to 18,700 in FY25. Before I move on, any questions about this aspect of the budget?
Okay, so you're saying for the non-capital equipment, that's what you're saying?
Mm-hmm.
And so you're saying for FY '25, it was 18.7, but for '24, it was 8,100,
8,700.
700.
Yes,
So that's a very large increase.
it is. And
Okay.
we're very grateful. I think it supports the growth that you've seen in the department. So you heard me speak earlier. We've increased the size of the department by 35%. And so new staff need new computers. Our modernization efforts also account for that. So when I have people in the fields, we're trying to equip them with child, I'm
Tape.
old. You know, the tablets. Thank
Tablets.
you. Thank
I
you.
was gonna say
Thank you, Alderwoman. I'm
tabletops.
old. We didn't have them as kids, but tablets so that they
Right.
can really interact and get business done in a timely fashion. And so we got a lot of support there.
Okay, thank you.
I got a quick question.
We'll go through the
Okay.
committee real quickly, just a first set of questions. Alderwoman Boyd, do you have any further questions? Alderwoman Velez,
Oh, you asking questions now?
what is the,
So the next page will be the use tax.
I'm sorry, Dr. Mahdi, just real quickly, just to go through by order of seniority, Alderwoman Velazquez, questions at this point.
I did.
Dr.
So are we looking, the question I have, are we question on 327 or from her presentation?
Well, what we could, I was actually sort of thinking that Dr. Mahdi could just run through all the numbers, but if we want to take a quick break and take a series of questions on the presentations, we could do that. I thought it would be helpful to kind of run through all the numbers.
If that's helpful, that will be very quick, because honestly, I'm not going to anticipate where your questions on the numbers are, so I can just quickly let you know for each section if we're stable, increased, or decreased, and make one or two comments about why.
Okay,
that helpful?
that's fine. Yeah,
Okay.
that's
All right, thank you, Dr. Mahdi. We'll do.
We're now on page 328, and looking at the use tax for the Director of Health and Hospitals. The FY24, bless you, the FY24 amount was 3.4 million and some change. We're coming in at about stable, still at 3 million this year. Most of the decrease there is in just making some conservative decreases across the city, quite frankly, in travel out of town. Page 329, we'll look at the Healthcare Trust. If you remember from my presentation, this is where we talked about the Behavioral Health Bureau accounting for most of this. In FY24, we adopted $1.1 million, and we're coming in at basically stable for the FY25, literally just a few $1,000s increase there. If you look at the subtotal and I apologize, that's just for personnel. So that reflects that personnel was basically kept stable. For the rest of the operational funds, you're seeing in FY '24, $3.7 million. That's down $1 million to 2.7. It still, however, balances out at the total trust at $5 million because the trust is stable. Inmates and medical, there's nothing new to report. We let you know that we have a $2 million a year commitment from the city, from CJC around oversight and evaluation. So that comes to a total there of just over $2 million on page 331. On page 332, you are now seeing the Equitable Relief and Utility Tax Fund. This is through our partnership with Heat Up St. Louis. And so this is a staple in the community. Heat Up St. Louis provides these critical services around heating and cooling for the most vulnerable in our city, and we are proud to continue to partner with them this year. That is what you're seeing on 332. Page 333, we're looking at the Health-Led Remediation Fund. If you'll excuse me, Emmanuel, why are we not seeing? Do you mind coming up? For the fund here.
It should be on another page.
So you're not seeing the numbers for FY '25 because I believe this part of the budget was reallocated. It's not that it went away, it was just reallocated. Is that correct? Okay. We'll now move to 334. These are our grant section. As you heard me say, we're just over 52% grant funded in the Department of Health. And so many of these, this will be a hodgepodge of our personnel and operational costs across the department and different bureaus, accounting for the myriad of grants that we receive. And what you're seeing here from a personnel perspective is a slight increase from FY '24 to FY '25, just over $200,000. And the operational costs have also gone up by just over $100,000 on page 335. I'm going to skip the Department of Personnel schedule. I think the global feedback here on pages 336 and 337 is we asked for about 34 new positions. We got about 11 across the department. And I'm happy to speak about critical ones in questioning appropriate.
Okay, with that, I will turn it over to the committee for questions on the entire presentation in order of seniority. Alderwoman Boyd.
As a commissioner.
Yes, I thank you for comment, Dr. Mahdi. And I guess my question, because I know that since COVID, you have been really struggling with staffing, the whole staffing piece. And so where do you think you are in regards to improving your staffing? You know, what percentage have you gotten, you know, your staffing up or?
So when I joined the city, there were about 85 staff for the Department of Health. We now have 131. That reflects over 35% increase in 2.5 years. Honestly, if you look at the gross numbers, I hired over 120 people over that time, but the turnover rate in the city is significant. So to show you why retention is so important, in my first year, the retention rate for the department was over 40%. In my second year, with some of the implementation around employee satisfaction improvement efforts, we slashed that number to 22%. And now my third year, we're looking at just over an 8% turnover rate. So really focusing on retention, I think, is helping. However, as you know, we are currently in a hiring freeze, which will likely slow down our hiring efforts for a while. And I'm very confident that once we are out of this necessary space, that we will continue to fill the department. But overall, you have seen your Department of Health grow by over 30% in 2.5 years.
Okay, and so on your lead, you said that it was reallocated. Where was that reallocated to?
I'll have Emmanuel look at that for you. We're still going through the budget in detail, but I think there was just some reallocations from one year to the next year. So it exists. I don't know where on the pages it was. Emmanuel, if you could take a look. Okay, we'll get that to you, Alderwoman Boyd.
Okay, and then the other thing, it was on the, I was looking at the Department of Health family, community, school health, maternal child health. And so with the infant immortality, how are we looking in regards to that?
So the mayor's office has provided us with $500,000 in support through ARPA to really augment the support that we have already been given in the budget. So we have built a strategic plan around maternal child health. That means looking at the spectrum of care from before a woman is pregnant through the prenatal care to the part where she's born. And then the most critical time in a child's life, as you know, Alderman Boyd, are those first 6 to 12 months. And we are focused very much on a strategic plan around that. We have built a coalition of partnerships through our hospitals, FQHCs, and through community-based partners that do this work. But we will be presenting in the monthly reports that I make available to you in the next, if not next month, it'll be the month after, our focused strategic plan about both maternal and infant mortality.
Okay, so I know a big issue that has come up that I've encountered, and then probably other people have encountered, is mold. So are we looking at some kind of strategic plan to start addressing mold within our communities? And I'm looking at, because most of the old buildings, and I'm running into residents that are actually in that environment of black mold within their buildings. So are we looking, because I know we have a lead program, so are we looking at a mold?
Yes, so the mayor's office has taken a leadership approach because mold enforcement is not embedded within the Department of Health. Right. We provide consultant, we work with the building division, but this is a multi-departmental effort. Those conversations are ongoing. I really have to shout out and champion Casey Milberg, who works with all of your offices so diligently. This is where things can get lost in the weeds. Whenever you have something that has to be across departments, as you know, Alderwoman Boyd, it can be really difficult to execute. Mold is one of those examples. So if you read the current legislation and policies to support mold, health is not really empowered to have a lead position or a true enforcement capability. But Justin Hauser, who many of you have known to be the Bureau Chief for Environmental Health, a phenomenal leader within our Bureau, works very closely with building, who really are kind of if I had to pick one lead department, it would be the building division to make sure that there's awareness. So now that he's coming out of emergency preparedness was embedded in his bureau during COVID, we're doing more education around mold. So if you remember during the floods, it was the city of St. Louis Health Department that had the lead educational material around what mold looks like after a flood, how it affects your body. We have those materials, and we're happy to make those available as well to all wards.
Okay, thank you very much.
Absolutely.
Alderwoman Velazquez.
Great. Thank you, Dr. Mahdi, and thank you to the staff for being here. I always appreciate your work. So I've got obviously a few questions. The first one that just jumps to mind, and I assume that I think we're not excited that the situation has led to this, but we're glad. I'm grateful that your department is and working with the CJC to do the inmate medical program. Will you be providing a more detailed update to public safety, or at some point to the board?
Come whenever I'm invited. I can't just pop up. So I have been invited to public safety. I showed up, as you know, I was there for a while, did my due diligence. I was recently asked to present before DFOB, that is recorded and live, and I brought a report to the DFOB meeting either last week or the week before. So you all know me. If you need something, I don't think any of you have ever heard me say no unless I'm not. But
I'm looking at Vice Chair of Public Safety over there. No, great. I would like to learn more, and I'll check out the DFOB video.
Yeah, the DFOB hearing was really helpful because they submitted questions in advance. And so we came in, I didn't want to have a fluff presentation. We addressed each question systematically and gained a lot of really great feedback. So that, as they always are, that one's recorded as well. And I think great information.
Yep, maybe Kimberly could send us the link. Okay. Another general question. Do you know how much in revenue the health department gets from the permits that you issue?
It's a great question. I never answer a question I don't know, so I will actually get that information. Manuel, if we can just make a note, I'm not sure. But I know that the sections that contribute to revenue building would be embedded within environmental health. So our food inspectors being the lead part of that through permits and other things. I'll make sure to get those numbers back to this board.
Okay, great. And just looking at the revenue that you all, the general funding versus grant funding, just where are the grants mostly federal grants, state grants, or?
Yeah, so the vast majority of those grants are federal funded. And that's why I don't think you were here, Alderwoman, but we, through the support of Mayor Jones about a year and a half ago now, we advocated for a first before partnership with Armamino accounting firm, because I just believe that fiscal strength is so important. And when you have 52% of your budget grant funded, I don't think what people understand is that that's a lot of monitoring. That's monthly reports, that's requirements, that's audits that the team need to prepare for. So a few things that we've done in the Department of Health to really strengthen that area. There were about 4 employees at the lowest of my first 6 months as director. We now have 11. We even have split our fiscal bureau into the grants section and then the general fiscal area. Our 4 accountants now have a dedicated supervisor, which they never had before. I really have to give Emmanuel his flowers. Emmanuel was expected to do the work of really everybody in fiscal when I first came, so it's been strengthening the infrastructure. We also were supported through not last year's budget, I believe the year before's budget, through the mayor's office to have a full-time auditor. That has really strengthened our ability to make sure that we are compliant with that 52% and what it requires to keep and maintain those federal grants. Lastly, we have been supported significantly through the mayor's office and ARPA, and that requires reporting and compliance and auditing too. So we have spent a significant amount of our time. So one of the things I asked support for and was granted was for an accounting firm to come in and to build SOPs, standard operating procedures, that we never had. We built an invoicing tracking system that the department never had. We, through the leadership of the commissioner, who came in with over 20 years of grants management experience in her career, built a grants management and tracking system. So we really bolstered our ability to address the significant amount of grants that we do house, most of which are federal funded and are very specific in their requirements, through increasing our hiring, in restructuring the table of organization to support it in a way that made sense, in building SOPs to support that, and lastly, in building this accounting firm. I'm very sad to say that we'll be saying goodbye to them. I feel like they're a family now in the health department. They've been with us for just over a year and a half. And so through our partnership with Armamino, we've just really fortified and brought a legacy that will, long after y'all forget me, I think that will serve the Department of Health and our fiscal bureau immensely.
Thank you, Dr. Mahdi. Is there a grant writer on staff, or is that kind of how you, in that structure? I know.
Oh, grants manager. We have tried. So we built a new position. Again, when I ask, the mayor's office rarely doesn't, isn't in a position to do what they can to support. So this was a position I went to. I was horrified when I took this job, and I was like, there isn't a grants manager? There's a person who writes or manages grants for a department that is 52% grant funded. It was wild to me. So we were supported, again, through, I can't remember, was that the year before last budget? That wasn't last year's, our grants manager position. The year before last budget. Recruiting a grants manager is hard. You're competing with private sector, right? And the salary is just not as competitive. So we are still working with Department of Personnel. We're working with some of our business and major tertiary education departments to try and recruit for that position. But that and nurses are 2 of the most difficult positions to recruit for, because it's just really hard to be as competitive as the private sector.
Thank you. One final question for me. I noticed that there's a line item for memberships, and there's obviously investment that you talked about with that. It ties into retention. And just when I briefly worked with Kimberly before I ever became into this, I was a consultant with the Department of Health. Can you just talk about, and at one point, obviously before your time, the Department of Health had lost accreditation, right? So it seems like there's this mix of, you have to be able to maintain and compete with other health departments, and that requires investment. But when you look at the line item budget, it's also a cost. So can you just talk about how that looks like it's in the budget, and how, and I would assume, but obviously I'm not you, how important that is to maintain both those relationships and really compete in the public health, or at least be competitive in the
Yeah.
public health sphere.
I really appreciate that question because reaccreditation is not something that I get asked about or people on, but it's the bread and butter. It's how we stay alive. It's how we are able to be eligible for a lot of the funding that we require to survive, that literally pays a lot of our staff. And so we have just completed a 3-year process of reaccreditation. And the lack of a focused bureau around quality improvement and those reaccreditation efforts, we had one person doing the work of all of reaccreditation, and that's a regional effort. We work with the county. We have over 50 partners that partner with us, and we launched our 5-year reaccreditation strategic plan just last month. And if you haven't been to that website,
ThinkHealthSTL.com or .org.
that's the only homework I'm going to give this esteemed committee is I want everyone to go to thinkhealthstl.com and become aware of this comprehensive document that really lays out the reaccreditation 5-year regional 50-partner strategic plan to keep us reaccredited. So we are currently in the process phase where we will find out this year. Please send many thoughts, prayers, hugs to us that our hope is that we will be reaccredited. That opens up doors for everyone. It opens up our competitiveness compared to other departments, our ability to raise funds through additional, more competitive grants, and really our ability to even do some of the enforcement things are all dependent upon that reaccreditation cycle that, like I said, is 3 years. So Rhonda Bartow, an over 30-year veteran of the city of St. Louis, is the leader and champion of our reaccreditation efforts, but to expect her to be an office of one is just not reasonable. So I'm very grateful to the mayor's office for helping us build out a small and mighty team. And I know, in future years, you'll continue to hear me. I want to be able to say in the next couple of years that we have a dedicated bureau around those efforts.
Thank you. That's all the questions I have, but I very much appreciate your answers and your work and your commitment to making St. Louis a better, healthier place.
Thank you so much.
Alderwoman Saunier.
Thank you, Madam Chair. Hello, Dr. Mott.
Hello, Alderwoman.
You know how I'm gonna start? I'm gonna start by giving you your flowers.
Do it, girl.
You know
Cry a
what
bit.
time it is. I just think you've been doing such an excellent job. Like I really, truly, we've seen each other in neighborhood meetings across the city while I was, doing things for legislation. And every time I see you, you speak really well to people. I think that you do a good job of making what's very nuanced and something that honestly I think people don't have a lot of awareness of. I think you do a good job of explaining that and also like channeling people's frustrations, very valid frustrations. And I know that's not easy, so I want to thank you. And I also know that a part of us being a Democratic city and a super Republican majority state is like we value public health. And so when we have COVID and we have other issues, we believe in doing whatever is in the best interest of our residents' safety and their public health. And other officials disagree with us and the city gets targeted and you are our public health director. And I know that that I've seen those targets come and you've still exercised leadership and bravery and honesty. And so I also want to just put it on record that I'm excited that you always do what's right, regardless of the other pressures. Of course, I do have a couple of questions.
Absolutely.
The first one, could you just talk a little bit more about the Behavioral Health Bureau? I remember last time you were here, you actually told Alderwoman Boyd that you were going to bring the van right to outside her house.
We leave the building. I was looking forward to asking her to say on record, show up to her offices. And we have a picture to prove it. So let the record reflect that I told the team, you can do whatever you want at that meeting, but you don't leave without a picture. But in all seriousness, it has been such a joy to watch something that never existed, literally never existed in 2021, have a life of its own. That takes leadership, that takes bravery. Mayor Jones had to do a lot of steps before I was even empowered to do that. The first was being just the championing an office of violence prevention. Because I think people now forget that before that office existed, that work was just subcontracted out through health. And so I was expected to come in, address violence prevention through purely contracts, and then also build a behavioral health bureau. So there's no behavioral health bureau without the Office of Violence Prevention. So I just really want to give her and the leadership and Will Pinckney their flowers in that respect. That move then allowed health to focus on the Behavioral Health Bureau. And I'm so proud of what we've been able to do. We've put to date over, are we at 2 million yet in RFP monies back? 1.6. I'm getting to my 2 million. I've been watching that ticker go. That's been a goal of mine. We've put $1.6 million to date, and we will surpass the 2 million before the end of the year back into community through very intentional meetings, talking to the leaders in behavioral health in the city, especially in North City, especially in parts of South City that have the worst disparities around mental health and around substance abuse. We ask them, what do you need for this money? There's a lot of RFPs in the city, but if you don't really ask people what the barriers to them applying and what their priorities are, not the ones that I assume from my office at 1520, then you're not really serving the people. So to see people respond in such a robust way, and for us in 6 months being able to now reach that $1.6 million is just a feat. We have put out over 2,000 Narcan boxes. Alderwoman Boyd and different wards were coming to every ward. We have them in the recreation centers. We are educating folks. You rarely see a community event that is even slightly related to public health or health that doesn't have my behavioral health bureau there. But it's also the work that goes unseen, right? These people are so passionate. My team is so passionate that they called me in tears. Said, guess what, Dr. Marty? I braced myself. I thought something bad had happened. I said, we got our first migrant community member came to do you know what that takes to trust us, to drive to 1520, to come to the fourth floor with their suitcase? It gives me chills. They came with their suitcase to our bureau because we have now garnered and have been building trust and awareness within the community, right? So they are doing at least 30 linkage to care calls. That means even though we're small and mighty, even though we don't have clinical services, and best believe I'll be coming for those in the next couple of years too, people know that if they're in trouble, they can call my team, right? We're getting the fire chief calls. Dr. Marty, we had this situation, right? There's a tragic shooting. They're asking behavioral health to provide services. They do the work of showing up at meetings across the city. And then we have also done so much to build infrastructure. They have trained, God, Julie's gonna kill me for not having up-to-date numbers, but I think we're at close to 30 trainings within the city across departments around mental health, stress, wellness, how to use Narcan. They have been in CJC since January training as well. So I cannot speak enough about the work they're doing across education, linkage to care, substance abuse, and criminal justice, to name just a few. And y'all know this. I mean, you're asking this question, but you know this because they also took the time to schedule meetings with as many older people that responded. They're still going across different wards. So those that haven't met with them, those meetings are coming. We're dedicating 2 hours each slot with information that's ward specific. You know, on one side, they're telling you what your data is that's ward specific. On the other side, they're giving you all the resources and numbers to call. I could be here for the next 2 hours just talking about the incredible work of this team. And what I'm most proud of and what really makes me, I don't know, emotional is that if you look at the composition of that team, over 80% of them are from North City. Over 80% of them are born and raised in the very communities that they're fighting for. That just hits different. So I don't know, you may want to cut me off because I could keep talking about
No, I wanted you to do that. I love that you have, you know, I think that's a sign of those of us who really love our jobs and who really love what I do, like the passion and the excitement. You almost made me forget my next question. I'm just so glad 80% of them work in North St. Louis.
Can you imagine? It's a beautiful thing to see.
Yeah, that's incredible,
Yeah.
honestly. That's really something to be incredibly proud of. Nobody's going to serve us like us. So that's something to be incredibly proud of. I wanted to also ask, I know like one of the things when I had my meeting with the mental health specialist, we talked about like a part of my ward having a lot of youth in it.
Yeah.
And part of my ward, I think, has, of all the areas within the city of St. Louis, has one of the highest amounts of youth. But on the flip side, we talked about the infant mortality rate.
That's
and I
right.
know that, you know, I think it's common knowledge that it's something that people suffer with across the board, and especially women of color. So I would love to hear more about, and I understand there's a lot of work to do, but I know that you've been building out, because we got a chance to talk about it, some of you're putting in place for new parents, folks who have given birth or prenatal wise. And I know that the city actually has some RFPs out and moved some money around because of some unfortunate policies at the state level and things. But I would love to hear about just kind of what we're doing preventatively and front facing once folks are here with new children, how are we supporting our parents and our families?
Yeah, the strategic plan for this that you will get in your inboxes has to be robust and comprehensive. First, the foundation is embedded within the Family, Children, and School Health Bureau, led by Bobby Williams and his fearless team. This is where you really have to be grateful for where the ARPA dollars that have been afforded to all of the departments have been doing their work. You heard me talk about over $500,000 in doula services. That was last year. And we have been afforded another $500,000 to really expand the work specifically of maternal child health, right? That means, I have leadership that listens to me. When I say listen, last year this was the issue. This year we've got to focus on this. Reallocated $500,000. So that is specifically and only, not undiluted. And what I love about it was being really intentional to say, Dr. Mati, we're not going to tell you how to use these funds. Can you present to us how you would like to, and we'll see how we can. And that has happened. So really excited about what that extra boost will do within community. I'm big on plans, child. So we have also, you heard me talk about the restructuring of the table of organization. One of the things that is new to the Department of Health is Kim used to just be a one singular person within communications, and it almost retired her. But she held on. She is now built as a supervisor, promoted to supervisor, and built a communication sector. And in FY25, we are building that out to an entire community outreach plan. The 2 mobile vans that the Department of Health was afforded, again, through support of ARPA, and the mayor's office has afforded us the opportunity to now have a strategic plan around community outreach. That's important because you hear me talk about we've trained the department in doula services. We're bringing national entities to the city of St. Louis around maternal child health and infant mortality, but the work has to happen. And if you really understand health disparities, right? All those social and structural determinants of health that become barriers to people thriving and to our babies really getting the start that they should at the beginning of their life. We've got to bring those services into community. So under the new manager, Shantae Fluellen, if you've ever met with Shantae, you know that she's a phenomenal leader. She is now overseeing this very new community outreach bureau within the Department of Health. She has put together a 30-page community outreach strategic plan. And one of the things she's doing is bringing back what the woman who opened the door for me to be your director of health, Melba Moore, the first Black woman director for the city of St. Louis. In Melba's days, you all used to get a newsletter, and it was neighborhood specific or ward specific, I believe. So we have looked at that, and we're bringing back and giving her flowers for that initiative, those types of things that will help us to fortify that community outreach plan around infant and maternity health. Lastly, I think partnerships are really critical here, right? If our hospital leaders, our FQHCs, and our community-based organizations don't have the same unsiloed, I know that's not a word, but we're going to make it a word today, approach to working together, it doesn't happen, right? So the delicacy with a woman in prenatal care being rushed to the hospital to give birth and making sure she has every affordable resource to not only take care of herself, but take care of her baby requires a multifactorial approach. So that's really what you're going to see in the plan that will be in your inboxes.
Okay, this is my last question. Can you tell us what some of the challenges have been with filling your vacancies?
Job market is tough. We're not a Fortune 500 company. That's it. But let me tell you, Taleo launching last week had to be one of my favorite weeks in the city. I have to just really champion an administration that says, we're going to take you out of paper, right? To come in October 2021, I have to sign stacks of paper this big and review them. The kind of error prone that is, the just wasted effort. And since then, for us to have Oracle, UKG, and now Taleo. I mean, if you haven't gone to the new website for personnel, you've got to visit it. It's beautiful and it's accessible, and it allows us and the public to see the same thing with their requisitions. And so that has always been the challenge. The challenge has been an archaic system for decades that also is not as competitive as the private sector. And I think that we're making those strides, right, through what Director Jenkins Gray has brought to us in this new Taleo system, in having, one of the things I did, you heard me talk about 2 years ago, was dedicate one position fully to just working with the Department of Personnel and HR. Michelle Turner, a 30-year veteran of the city herself, I think she's a 29, works directly with them. And like I said, I attribute that 35% increase in growth to some of those strategic areas. But it's always going to be salary, 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 and those recruitment and retention efforts that have been the challenge.
Thank you. Salary, salary, salary. I just want to repeat that for my colleagues. Salary, 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 salary. I think that is all of my questions. Just the last thank you. And then I do have a request probably from Alderwoman Velasquez and myself and Alderman Cone. I'm just planting to see early. I see Director Cross in the room as well. We're working on a back to school sort of public health fair. And I know that we will probably want to have the public health folks there. So hopefully Director Cross can hear me and everyone else, because I think we'll probably definitely want the Mental Health Bureau or Public Health or in some way have some of the resources we have in the city there at that fair. Thank you.
We want the kids healthy and back to school.
And the parents healthy too.
Yes, thank you for that.
Is it my time, Madam Chairwoman?
Alderman Aldridge.
Thank you. Thank you, Director, for being here today. I'll keep it brief. You had a great presentation, very easy to kind of follow through. Just want to echo, thank you for your leadership. And it sounds like thank you to the mayor for really supporting the fabulous work that you're doing and making sure it can get done. With the doula services, is that coming from ARPA or general? ARPA?
Fully supported through ARPA funding through the mayor's office.
Okay, and what would that look like?
Yeah, so like you heard me say, we reached out to Jamal Birth Village, and I first think that
she's amazing.
Just shout out to Okunshula and her historic current and future leadership and championing the doula movement nationally, but really in the state of Missouri. I don't think people understand how much work that takes, but really shout out to all the doulas across the city. It's easy sometimes to always focus on one specific entity. There are a lot of incredible doulas doing this work. And they specifically address the health disparities within the maternal child health sector. I'm tired and I'm in heels. Remind me of the question again.
You can sit at that table. That's why we brought it.
We want to say alert.
Yeah, no, I was just curious of what that service going to look like. Yes.
Will be. So we first started with the foundational part, which is training the department. We didn't even doula was something that was out there that we were hearing about, but it had no presence within the Department of Health. So Okunshula herself, the head of Jamal Birth Village, came in and over a month dedicated way trained the entire bureau, so that even if you're not doing the work of the new doula program that we're trying to build and have established within the department moving forward, you have awareness. I want anyone who even touches that work to understand the history of the doula movement, to understand what it is, why it is, how we implement it, right? But again, in the absence of clinical services, our work will be mostly to be a convener, to partner with other services, to mentor women. We have foundationally within that bureau connected with women across the spectrum of childbearing, women and people who bear children across the spectrum of childbearing. And so now it is making aware that there is this option available that centers you, that is culturally congruent, right? And provides you with that extra added level of support. And so the strategic plan, in the absence of actual clinical services right now, is going to be around that linkage to care piece. We have a champion who is now stopped her job as a community sanitation officer and is completing her doula training to be a certified doula. Having her embedded within the health department and building a team of doulas is my dream. But for now, I think it's important to honor the work of the doulas who have been doing this work for years. So the priority for the ARPA dollars that we were afforded last year that went out to a variety of partners is to champion their work, learn from them, and now to embed it in the health department.
Gotcha. Well, as that move forward, because I know we won't have ARPA dollars forever, let us know how, we can continue to support, and probably won't have to let us know. I know this is probably something important to the mayor. I got aware of kind of the doula service on the State House former state representative, one of our good friends, Cora Faith Walker, was a true champion of the doula services. Also, for the support of doula services, as that program started to move out, if it's ways that we could connect women to that program. I know you're big on planning and making sure every I's are dotted and T's are crossed before you just do something.
Otherwise, y'all come for me. Do this, Dr. Mati. You didn't do that. So we plan accordingly so we can.
Yeah, just let us know how we can help with that. Quickly on the CJC, is those ARPA funds or is those general, or is that a grant for the inmate medical?
No, that's not ARPA. That is a commitment from the city of St. Louis.
So
When I
that'd be-
say, Mayor Jones said, this is an issue, we're going to empower you, CJC dollars have come into the health budget to support that. It could not be more grateful, and it's really helping us to get that off the ground.
Gotcha. Well, those questions I'll wait to if we bring you back public safety because we just talking about budget and not direct. But just thank you for all the great work you do for the city of St. Louis.
Thank you.
Thank you, Alderman Aldrich. Dr. Madi, thank you for being here again and for your service. I echo the same with my colleagues who are just extremely grateful for your service. I have a couple of questions just to kind of round us out.
Yeah.
The health department, you and I have discussed this previously. The health department has in the past provided detailed reports on the status of different health measures in the city and, kind of highlighting, for example, the pockets of real high levels of lead exposure. And as you know, this is an area of, I would say, extra importance to myself as a mom, as a single mom who experienced this in her ward and throughout our communities. Do we still provide those yearly detailed health reports, or can we look at kind of maybe building off of those reports that we produced several years ago? They're so informative. We used to produce them on a ward basis, neighborhood basis, so we could kind of see where some of the pockets are. It helped, at least for me anyway, to understand that the previous 20th ward was a real pocket of need for lead remediation work, and really propelled myself to go out and knock doors and try to get folks involved in that program. It also really highlighted the areas of asthma, other areas of real extreme high level of health disparities. And so I'm curious if we have.
Yes, we do actually. So you guys get you get KPIs for lead every report that we emailed to you for the last 2 years. In that, we give you the KPIs specifically around lead. So we chose lead based on feedback that we actually got from you, feedback that you provided as well to me specifically, because you've championed this work, not just now, but historically as well. So those KPIs are available every month in the report. They're briefer there because it's a monthly. We then have our Epi Bureau has an entire section of our website dedicated to our annual reports, and within that, you get the lead report every single year as well. So that's been ongoing. And maybe it wasn't clear when I said this previously, but that community outreach plan where you will now be getting newsletters will include that data as well. So we're currently giving it to you monthly, annually on the website and in the monthly reports, but I really welcome feedback. In my monthly reports, I'm like, we need feedback. And I know people get exhaustion in reading reports, but we can't give you what we do need if we don't hear back. So yeah, we get those monthly.
Yeah, I'll take a look at that. Thank you. I think, those monthly reports tend to sometimes, unfortunately, get bypassed over just because of the regularity, but certainly the annual reports are a little, with the less frequency, broader view, easier to digest. I think I'd be happy to provide some.
Absolutely, yeah.
Speaking of which, the disparity studies that the city conducted several years ago really highlighted some disparities in health outcomes. As I mentioned, two of them, the two biggest disparities were in asthma and lead exposure, which have lifelong impacts. One of the things this committee has been doing, in addition to its budget work, has been taking a look at the long-term, sort of financial viability. One of the biggest things threatening that is a loss of population. We had Dr. Ness Sandoval come 2 weeks ago to this committee and talk about the massive population loss, unexpectedly, but certainly a welcome part of that presentation. he discovered, or at least was able to kind of highlight through his work, massive disparity in lifespan in our populations, particularly in our Black populations throughout every single age group, a massive difference in lifespan.
Yeah.
This was enormously alarming, I think should be to all of us, especially considering the population loss we're seeing is primarily from communities of color, which are the only communities nationwide that are growing. So this is obviously an important aspect of health and wellness for our community, but also from a financial budget perspective. If we're going to continue to be a city that can fund departments like the health department, we have to have a population base and a tax base to pay for services. So, this is not a question, but certainly I want you to know that this committee is taking a look at those issues. We care about them. They impact more than just the sort of fuzzy side, the healthy side of health and well-being, but certainly the financial well-being of our community as well. One thing, with regards to the follow-up, the inspections that the alderwoman from the 6th requested, kind of those permits. You and I have talked about, there are lots of different permits that the health department issues, but there are also some permits that the health department is the beneficiary of. For example, the demolition fund, the demolition permits require an additional fee that now should go to the health department. I know it goes to the general fund, but would like to maybe take accounting of that to make sure that those funds are going into the air quality monitoring program. So that you have the funds you need to do some of that work. Lastly, with regards to the reporting and sort of staffing and that sort of thing, it would be helpful to kind of understand what you hit on some of the STDs and STIs. That's an issue that I think is really obviously the city has been on the unfortunate side of the statistics on that, being at the high level of that as well. So perhaps it might make sense for us to take a look at the numbers and the reports before kind of weighing in more heavily. But I know that
Alderwoman Boyd has been great. She's invited us to present on STIs, on syphilis, on this issue at her committee as well. And we can make those PDFs available to you, but I couldn't agree more. And I thank you for highlighting that critical issue.
It's such an important one. And just lastly, as part of that, Dr. Sandoval, one of the things that really surprised me was the high level of accidents being the #2 killer of African American populations. I had no idea. That seems like such a preventable end of life. So, whatever we can do to support those efforts, I think, again, we're just taking a look at those statistics.
No, that's great. I mean, we do a weekly, I've been on the radio weekly at 9 a.m. every Tuesday, Streets 105.1, really bringing public health to the community. We talk about accidents, wearing seatbelts, because I don't think it connects for a lot of people as a health and public health issue. So I think education is central to that part of it. And now having these really great collaborative relationships with public safety, Director Chief Coyle, as I lovingly calling him, works really well with us to just make sure that we are getting that message out.
Excellent. And lastly, along that accident side of things, it's not just the vehicle, but we are in a pedestrian fatality crisis, I would say, at this time. As of May of this year, we have had as many pedestrian fatalities as we had the entire year before. And so this is obviously an area of alarm spanning beyond what the health department can do, but certainly is an issue of health and wellness for our community. With that, do we have any additional questions for Dr. Mahdi?
Flowers.
Thank you.
If you don't mind, Dr. Mahdi, it would be helpful too. I know you've been so supportive of your own staff and protective. I know alderpersons historically have taken the liberty to kind of communicate directly with staff members, and you've helped I would say, support your staff by being a funnel. If there are staff members that you want us to directly communicate with, or we can communicate directly with, or if there's a chain of command you would like us to utilize, especially when it comes to animal control and issues that we get direct communication from residents on a regular basis, feel free to communicate with that with us. We find it enormously helpful sometimes to be able to have a direct communication when it's appropriate.
One more question.
Alderman Aldrich, did you have one follow-up question?
Yeah, the animal control part, because I know it's important when we have these meetings that, it is clear what we're talking about. And I know during the public comment, there was this belief that animal control was cut. So it is under your department, correct? Animal control. Okay. And we just added, the mayor put $1 million.
She sure did.
And that money is to go to like,
So a variety of things. It's primarily going towards the new animal care shelter. That's the top priority, but it's that aging fleet. It's all of the protective services, whether it's garb and resources they use within community. But number 1, 2, 3, 4, and 5 is a new shelter.
gotcha. Thank you.
And then, thank you for the question. I will be very candid. I'm transparent in feedback. Unless there have been barriers to the funneled approach, I have to again say our team is in community from 8 till 5. So fielding calls sometimes, they'll show me, they'll say, we just got 10 emails from different older people. We just got another 5 from the mayor's office. And I give them work every day. They have actual work that they I think that's the only reason we're sensitive. I pride myself in being timely in communication. You rarely don't get a 24-hour response from me. I make it a point to be like, email received, I'm working with my leadership. The next day, you guys get where the status and report. If that isn't working for any reason, let me know. But that funneled approach, until we work out something that is standardized in being reasonable and standardized in being, but it feels like a lot of people think that their issue is the singular focus of my supervisors and managers on any given day, and it's just not something they can maintain. So I don't want to sell you a dream with that. I wanted to let you know directly, if I am not getting you what you need, and if I need feedback because I am not faultless, let me know, right? But that is the reason why I will continue to advocate for this approach. I hope that helps. I know it's not ideal, but it's just, I can give you examples from day to day about what this looks like and the tone that it sometimes takes when people don't get exactly what they want. It's just, it's not appropriate. So, yeah. Never you.
No, that's very helpful. It's helpful to understand the process. Yeah. It's preferred by the department. Okay, with that, we will end this presentation. Thank you, Dr. Mahdi. We have our next presentation starts at 11. So I will ask that we take a 26-minute break.
Thank you for having me.
Thank you. Committee meeting back to order. Madam Clerk, would you please call the roll? Or wait, we don't need to call a roll off a break. Okay, thank you. With that, our second presentation of the day will be St. Louis Development Corporation. Mr. Richardson, if you don't mind introducing yourself and any staff members you have with you today.
Good morning. Yeah, good morning.
Click your, no. Turn it on.
Apologies for that.
There we go. Can you all hear me now?
You know.
Now I gotta put it up. Okay. So good morning, Budget and Public Employee Committee. Chairwoman Spencer, thank you for the opportunity for SLDC.
I'm sorry, I don't mean to, but he does need to be sworn in. Want to swear him in?
He does. Yep.
She
We
does.
do have to do it, okay. If you don't mind, if we could have everybody present here, just raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth? So help us all.
Yes. Yes.
So say us all. Okay. Thank you. All right.
Thank you. So again, thank you, Chairwoman Spencer, Budget and Public Employees Committee for having SLDC present today. I've brought along our Chief Financial Officer, Mr. Charlie Hahn, to speak directly to any specifics you all may have as it relates to SLDC's fiscal year 2025 budget. As the chairwoman of the Budget and Public Employees Committee, Chairwoman Spencer, you also have a ex officio seat on the SLDC Board of Directors. And for context for this committee, SLDC typically takes our fiscal year budget for approval to our SLDC Board of Directors in our June board meeting. So that's scheduled for June 20th of 2024. We will be seeking approval from the SLDC Board of Directors for fiscal year 25 at that board meeting. So Chairwoman Spencer, you will have the opportunity to ask additional questions to ensure that we reflect any feedback that's received today from this committee. So just wanted to make that initial statement. We have provided a draft budget for fiscal year 2025 for SLDC. So as you can see, this is really, as SLDC is a separate 501c4 nonprofit organization that's governed by its own board of directors. We are responsible for managing the economic development activity to support the city of St. Louis through 9 of our respective development boards that you'll see listed on this draft budget as SLDC agencies. And so as we are operating programs through SLDC agencies, we also staff and manage those ultimate boards. So these are all SLDC employees as well as employees to support and staff the respective development boards themselves. So what you'll see first on our overall revenues from community development block grant funding, first and foremost, SLDC admin major projects will stay consistent at $500,000. The second component here is the commercial district incentives. That has a decrease of $65,000. This is funding that we traditionally receive from CDA to manage the facade program. However, CDA is moving forward with managing this program themselves. So SLDC will not be receiving funding to support the facade program. This is a program that will be managed solely by CDA. We also have an additional $35,000 in our budget for property maintenance to support LRA, but then also other beautification projects that we have throughout the city. So due to the additional funding that we received through ARPA as well as through CDBG, we are looking to increase that total amount to $700,000 to increase our capacity to manage and maintain the inventory that we have through LRA. We then have capacity building for our minority business enterprises. We actually added new certification specialists and analysts to support capacity building for minority business enterprises as we are continuing to work through transitioning the certification process back to SLDC. We will be increasing our overall capacity from a personnel perspective. This gives us more flexibility and then also ensure as we're updating the ordinances as it relates to WMBE compliance as well as certification, we now have more capacity to oversee that program. Again, that's only an increase from $45,000, but we see that as important as we move forward. We also receive funding to support the City Councilor's Office as SLDC is represented by the City Councilor for all legal matters. So we have not requested additional funding for that specific bucket. As you'll see from SLDC agencies themselves, we've actually increased our investment with in the port, and then also have increased our revenues that we've been able to generate through the Port Authority, through the renegotiation of several outdated leases. Currently, the port is 100% leased, and what that tells us is there's a high demand of opportunity. And so being able to expand the capacity there at the Port Authority, but then also to move forward other initiatives that support SLDC operations, such as the disparity study that was funded at $600,000 A portion of this additional funding will go towards that cost that SLDC had to bear. Traditionally, we would receive funding from the city of St. Louis to support that disparity study. We did not make that request this past year when we completed the disparity study. So that's why we are requesting an additional $400,000 through the Port Authority for this next fiscal year budget to conclude the disparity study and to overall right size our investments in that area. LRA, we are not asking again for any additional revenue specifically from LRA. Again, we have property maintenance increase, but not directly from LRA itself. Our planned industrial enhancement board, PIE, we are asking an additional $50,000 there to support the overall operations of SLDC. The Industrial Development Authority, they continuously generate bond fees that supports, again, the ongoing operations to support all of the expenses that you see here listed. And so what we requested from IDA specifically is $150,000 more than what historically requested from the previous year, fiscal year 2024, to support, again, the ongoing operations of SLDC. And then finally, LCRA, we've decreased the number of projects that have been incentivized through LCRA, so we have not generated many new fees associated with LCRA, and so we actually are decreasing the investment from LCRA by $100,000 in this fiscal year, just due to some of the pacing that we want to ensure that LCRA stays financially solvent as we move forward. LDC, we do not expect any additional requests above the $30,000, which we've requested in previous years. And that brings our grand total of total revenue to about $4.95 million. And then there's other revenue that Charlie can definitely go into about that revenue bucket. I do want to go directly into the expenses. So what you'll see in our expense category is a significant decrease in our consultants. As we have noted, when I started at SLDC in June of 2021, it was important for us to start gearing up for our new strategy, our new implementation of the Economic Justice Action Plan, and then the ARPA resources that were coming into our stewardship. And so we spent more funding associated with consultants in that first fiscal year of 23. But as you can see, that's been significantly declining over the last fiscal years, fiscal year 24, and now fiscal year 25, anticipating our consultant total cost to be around $870,000, a $371,000 decrease from previous year. We are now into the full implementation phase of our work with the Economic Justice Action Plan and with ARPA. And so that's why you've seen an increase in personnel in order to execute on those programs. And I'll speak directly to ARPA in just a moment in the separate slide that I've made available to the committee. So that really brings us to our overall total expenses and revenue being able to be balanced out at $16.45 million. So I'll ask Charlie, if you don't mind coming to speak directly to the additional revenue that we have for other under the $9.97 million. And then we'll open it up to questions from the board, from the committee on this budget, and then go directly into the ARPA fund.
Thank you, Neil. Again, I'm Charlie Hahn, the CFO at St. Louis Development Corporation. First of all, the other revenue is comparable to what the last 2 years have been. And I got a list of about 20 items here, but some of the major ones are the SLDC is a recipient of about $700,000 in TIF and bond fees that TIF, the administrative portion of the TIFs were generated in the past, but we share in the administration with the comptroller's office. And that's, the bond fees are on projects where the blighting is not done by LCRA or PIE. The typical bond or the typical bonding authorities, because they have to blight the area, and sometimes the city will do the blighting, and we share in that fee. We bring the project to the city issues bonds in a non-blighted area. We charge workforce fees on development projects that exceed $1 million. We charge Prop NS for 3 staff, that's $295,000. We participate in the EcoDevo special allocation from the taxes. Historically, we've received, initially we received $1 million, we're at $920. We have 4 staff that actually work on city-related projects that we charge the city ARPA for those staff, and not the SLDC allocation. So those are in the ITSA, Building Division, and BPS. That's $540,000. Our own ARPA allocation for the staff is budgeted at $2.3 million, and we have a lot of dedicated staff and partial funded staff that participate in that $2.3 million. We have direct ARPA projects that we charge staff to. One is the beautification project, and this was all designated by aldermanic ordinances. Another one is the Economic Empowerment Center, where we charge $622,000. The digital equity, which is coming up this year, $133,000. And we have our outside funding source participant from MasterCard. We have $190,000 that helps fund a couple staff. We have new market fees, which generate when we close a new market transaction. This is a federal incentive, but we get a 4% fee on new market transactions, and $2.5 million is part of this budget. And then we anticipate salary savings due to delays in hiring and things like that. So that's $700,000. In all, it totals 9.970.
Thank you, Charlie. And I just want to bring to your attention quickly the ARPA appropriations that SLDC has received and expended to date. Again, this is only through March 31st, 2024. We've made significant progress actually on the North City Small Business and Nonprofit Grant Fund since March 31st. And we have new grant agreements for stabilization, capacity building, and technical assistance going out to approximately 160 total businesses over the next week. And then by June 20th, at our June board meeting, SLDC will bring forth the final recommendation for approval from the board for the competitive grants. So we anticipate the North City Small Business and Grant Program awards and allocations will be made in June of this year, so next month. And then the plan would be for us to start funding those projects as we get the necessary documentation, ranging from the CBI clearance, which ensures that a business has their license up to date, and they're up to date also on their taxes, because we cannot fund a project or a business that does not have those items updated. We've fully expended the small business grants. We have spent over $900,000 through the Northside Economic Empowerment Center. Build STL is the Killark facility, the new workforce facility we have acquired through LCRA, and now working on the programming associated with that project that will get us to that $8 million number. So over the next year, we'll have that fully depleted. The citywide housing fund, we currently have 40 properties that are being developed in partnership with Tabernacle Community Development Corporation and Habitat for Humanity that will be made available to individuals at 80% AMI or below at a for sale value. I spoke to the North City Grant Program. We are actually onboarding the lenders this week as it relates to the home ownership fund. So we will start that down payment and home buyer assistance actually this month. So really excited to get that accelerated. Already have individuals that have inquired and completed the questionnaire that we are getting into that pipeline. We have two revolving loan funds, small business and nonprofit revolving loan fund in partnership with St. Louis Community Credit Union for $2.5 million. So that will be an entire investment that we'll be making to them. And also with RISE CDFI for the Supplier and Contractor Mobilization Fund, another $2.5 million. Both of those investments are planned to be expended before the end of July. So really accelerating that progress. The Proactive Development Fund allows LCRA to acquire, to assemble, and to conduct pre-development on blighted buildings and HUD qualified census tracts. So really excited about moving that fund forward, but then also projects that are considered to be a nuisance to the city we were addressing through that Proactive Development Fund. The Neighborhood Beautification Program, we've actually entered into our first contract with a minority landscaper to start conducting grass cutting on LRA lots in the JVL and St. Louis Place neighborhoods. And we are actually approved through LRA at our latest board meeting to accept several new women and minority-owned contractors to start doing landscaping across the entire city for our almost 10,000 parcels that we're responsible for managing through LRA. So those funds, we are expecting to expand $2.3 million before the end of this year in 2024, and then another $2.5 million in 2025, and then expand the rest of the funding that we have available through this program in 2026. The LRA rehabilitation loans, we are actually moving forward with that program to ensure that we're not just doing minor stabilization on properties that are owned by LRA, but doing full rehabs that will then allow for individuals to acquire those properties. We are leveraging the Prop NS program for the buildings that have been nominated by the community and the neighborhood organizations to actually put resources into those projects and complete that rehabilitation. So we plan to expend those dollars over 2024 through 2025, well before the September 30th, 2026 deadline that we've established for ourselves for spending through ARPA. And then the final component is the Digital Equity Fund, which is to ensure that we provide greater access to Wi-Fi and high-speed internet through our rec centers, public libraries, and our parks. And so that work is being conducted in partnership with BPS as well. So by the end of this year, we expect 50% of these funds to be expended, with 100% of the funds projected to be expended by September 30th of 2026. We do not see a need for us scaling any of these back. We already have the funds appropriated and programmed towards specific initiatives. and items. So that concludes our presentation today. I know we spoke a lot, but definitely willing to answer any questions that you all may have.
Thank you, Mr. Richardson. And I will go through the committee by order of seniority. Alderwoman Boyd has stepped out. Alderwoman Boyd has stepped in. I literally just said the Alderwoman has stepped out. Alderwoman, do you have questions, or do you want a moment to collect yourself before as we go through questions?
Let's talk LRA.
Okay.
So, I heard you say that you have, I'm sorry. I had got an emergency call, my mind left. Okay, thank you, Mr. Richardson, my mind gone. But on LRA, I heard you say you were talking about a beautification for LRA
Yes.
properties. And so you said you had a contractor for the Ville and what other neighbor?
So it was for actually St. Louis Place and the Jeff Vanderloo neighborhood. But we are putting out a package for other areas right now. We're targeting the demonstration areas within the Economic Justice Plan. So that includes Walnut Park East and West, also Baden, but then also the 6 neighborhoods surrounding Project Connect along the MLK corridor, and then Dutchtown and Gravois Park.
Okay, and so I guess what I'm hearing, because now we're in May, which might as well say June, and so now you just got a contractor for those 2 neighborhoods. And the weather the way it's been, so whoever that contractor, God help them, because they're going to have to like double up because of the high grass. And I do know that forestry was trying to work with you all to help you all with it, which people don't understand. In March, when forestry dropped the lawnmowers, they're already behind.
Right.
So now I'm hearing, so you're trying to get contractors for these other neighborhoods. Forestry can't keep up.
Right.
So now we have LRA property that's overgrowth and high grass. So how is LRA going to address that?
Yeah, so that's why. So our goal is to have identified parcels on blocks that we can then package out and bid out to the contractors that have been selected. So, for example, with our first contractor, we had about 30 lots that they started with to start focusing on those lots every month to make sure that they get a fresh cut. Obviously, the first cut was more extensive. It took a little bit longer because of the high grass and debris removal, but now they're starting to accelerate their pace. The goal is to now that we've been approved by LRA to enter into contracts with these new contractors, that we can start actually giving them packages of properties to start to prioritize. We are coordinating with forestry and the building division on the properties that they're cutting and ensuring that we're not duplicating services. So we are able to share that list of properties that those private contractors will go out and be taken care of as we coordinate with the forestry division that will manage those other lots that are already on their list. So our goal is to build that capacity. What I would ask for all the alders is, if you have priority lots that that need continuous maintenance, that have created continuous challenges, to follow up with myself and/or Shelton Anderson, who leads LRA, and we'll make sure we have those as part of the package for the next round if they're not being maintained appropriately. Again, our goal is to look at all of the properties, but if there are properties that are a specific priority, we want to make sure that we're responsive to.
Okay, and so you already have contractors for 2 neighborhoods. It's just the other neighborhoods
that we're working.
You
don't. We're going to start those contracts now. So we're actually sending out packages of properties to the contractors that we've selected through the LRA Board Commission. They selected several contractors to handle the landscaping. And so we will be sending out packages for them to provide us with the bid. So then we can enter into that contract and they can start cutting those yards in those other neighborhoods that I mentioned. So that's the plan for this month, is to finalize those contracts and grass to start being cut in June.
So do you know how many contractors you all totally have for the city? I hear 2 for those 2 neighborhoods, so.
So I'll be able to provide you with the information. I don't have it offhand, fortunately. I believe it's 5, but I don't want to misspeak. I'll get you that specific number.
So in addition to the 2, you have 5 others that are
Correct.
going to take over the.
That's correct.
Okay, and so.
And that's through the ARPA beautification, neighborhood beautification program.
Okay, and so I guess my other question is the LRA rehabilitation loan. So what is that in detail?
So that will be a portion of those projects. They'll actually go towards the full rehabilitation of properties. So as you're familiar with the Prop NS program, for example, and we were able to put $30,000 to $50,000 into a property, right. We're recognizing that doesn't get a property to full stabilization for contractors. So our goal to leverage that $5 million to actually do full rehabs on a property and not just do kind of the smaller $20,000, $30,000 to $50,000. It's being able to fully rehab a property and then making it available for residents to acquire. And then also looking at some of our LRA lots to actually build new housing on those lots, leveraging these resources and then making them for sale to families.
Okay. So my favorite conversation.
Yes.
The North City Small Business and Nonprofit Grants.
Yes.
And so my phone has been blowing up.
Yeah.
And so me and you have had conversation.
Yeah. Yes, ma'am.
So where are we?
Yeah, exactly. So I was just trying to pull that information up, but I would say that we've had about 160 businesses that have completed the technical assistance at capacity for $5,000. We then have another 97 businesses that have opted into the stabilization of their business. So each one of those 97 businesses will receive $15,000 in addition to the $5,000 that they receive from technical assistance and capacity building. So we've sent out grant agreements for the technical assistance and capacity building. Dollars are beginning to go out to those businesses. That started on March 14th and will continue as individual businesses complete the program. And then the $15,000, we're actually taking those 97 businesses before our SODC Board of Directors on Thursday. And then following their review of those projects and those businesses on Thursday, we will send grant agreements directly to those businesses. And if they have cleared their CBI, they have a license, and they are up to date on their taxes with the Collector of Revenue, those funds would be dispersed within 10 business days of them completing that grant agreement. And we're sending it through DocuSign, but also if businesses need to come into the office, we'll have that available for them as well. So we anticipate another $1.5 million approximately to go to those 97 businesses over the next several weeks, the next 2 or 3 weeks, as they complete those grant agreements. And we are actually taking before our board of directors in June the larger grant amounts. So following the technical assistance and capacity building and the stabilization program, we'll have approximately $30 million remaining to fund about 600 or so businesses, because we had almost 700 applications and businesses that are eligible. So from that pool, we'll have to make a determination on which projects get funded that can actually get completed, that can actually create and catalyze economic development in those neighborhoods. And then that decision will be taken before the board with recommended dollar amounts on June 20th. So before the end of June, we will have identified across all of those programs, whether it's competitive, which is the facade, community expansion and enhancement, as well as the technical assistance and capacity building, all of those funds will be officially allocated to awardees on June 20th. So by June 20th, we'll have this process complete, and then the next step will be for us to follow up with those businesses and projects to ensure that they complete the proper documentation with the city, again, the license collector, the collector of revenue, and they can show proof of ownership. So that's our final process that we have in place right now. It's June 20th, being able to announce all of the awardees for the entire program.
Okay, and so my concern is not the dollars that you are distributing. My concern is the process.
Yes.
And that's what you and I have talked about,
Right.
because those businesses waited for almost 3 years for this whole process. And ironically, and as I told administration and I told you, we have some of those nonprofits and business that will have to close their doors because they've been waiting on us to do what we promised to do, and we never had communication. So my question to you as the president of SLDC, how are you looking to ensure this process is streamlined and is more communicated to these businesses so we don't get back into this situation?
Yeah, we've learned a lot from this process. The first and foremost, this is the first time there's been these amount of resources that have been made available to North City businesses. We received initially in the first application that we rolled out about 225 or so applications. Once the board bill was updated to make changes as it relates to geography, as it relates to allocation among different corridors, and then also what were the requirements for letters of support, we received an additional 500 applications. That was an unprecedented and unexpected amount. So our goal was to build the capacity to make sure that we reviewed every one of those applications for accuracy. We had businesses that were using city addresses that were located in the county. So we had to make sure that we vetted those out and moved them out of the bucket if they didn't fit. There were some businesses that had addresses in the county but actually owned property in the city that they were planning to redevelop, which is an acceptable and eligible use. So we had to actually schedule one-on-one meetings with all 700 businesses to really understand, do they qualify for the program and what is their actual request? We had over half of the businesses not complete a budget properly. So we brought in Morgan Graves Consulting and NDC to actually work with those businesses on completing those budgets. So then when they submit their application, as we review them, we can actually look at it apples to apples. And we understand that many of these for-profit businesses that were struggling coming into COVID and as a result of COVID have seen an acceleration of their decline, is they needed more capacity building support. And that's where that $5,000 grant was, to help them get that budget, help them get their finances in order, because without that, they would have been just thrown out of the entire program. And so our goal was to ensure that everyone received some support up front prior to us evaluating the full bucket. Because if we evaluated the full bucket based on just completeness, the businesses, those small businesses who have not interacted with the city previously would have been thrown out because they didn't have, the proper documentation or understand how to complete a grant agreement, because that's not their form of operations. They operate a business that they have every day. So our goal was to ensure that we provide that support. Now, as we move forward, we have those processes and understand how to better do these grants and also communicate more effectively with businesses. And so going forward, we have documented the process and where we fell short and how to shore up that going forward and ensure that we don't have this issue again. And we've created a standard operating procedure around how to address these things moving forward to overcome these communication challenges because it wasn't just the speed, to your point, it was also us not communicating effectively
Right.
with the community, and we take accountability and responsibility for that, and we're working to improve that communication at SLDC and with our partners.
Okay, and the last thing, it says, North City Small Business and Nonprofit Grants. You need to change the name because that's not who you all are targeting. So you all picked up other areas that were not North City.
So no, the program is 100% North City. So there's
Okay.
not any businesses south of Del Mar unless they're along the Del Mar corridor that qualify for these grants. So no businesses South City, it's all North City. Anything north of Del Mar per the board bill that was passed and the ordinance that was put in place by the Board of Aldermen on the last update. So the only thing that we changed from a geography standpoint is initially it had dollar amounts per corridor. Instead, we opened it up to having the funds dispersed across the entire North City and not just specific corridors and specific dollar amounts. Because as you may recall, the first board bill, for example, had like $9 million for MLK, but then on another corridor, it only had $600,000.
Right.
And so we wanted to go back and ensure that we provide a more equitable approach to businesses across North City. So we did not include anyone South City. This was specifically focused on city programs. And as it relates to those other small businesses and nonprofits that may have went out of business or going out of business, we have other products that we've developed, again, in partnership with the St. Louis Community Credit Union and RISE CDFI to ensure that we provide capital to these businesses at low cost. So they're below market on the St. Louis Community Credit Union program. It will be as low as 1.5% below market rate terms for those businesses because of the $2.5 million that we've provided to help offset some of the risk associated with those.
So all the businesses, because I know a lot of businesses that weren't going to get the grant, you all committed to them $5,000. So are they getting that $5,000?
Yes, they are. So we've already started sending those $5,000 checks. So starting March the 14th, that was our first round. I believe it was 49 businesses that received $5,000 grants on March 14th. Following that, we've continued to review the businesses as they've completed their training through technical assistance and capacity building. And we have approximately another 111 or so businesses that will receive that $5,000 if they've completed both of those programs and have also completed their CBI, which is the License Collector and Collector of Revenue information. So those grant agreements have went out. And then the stabilization grant agreements are going out again this Thursday.
Okay, thank you, sir.
Yes, ma'am. Thank you.
Alderwoman Velazquez.
Thank you, Mr. Richard. Thank you, Madam Chair. Thank you, Mr. Richardson, and Charlie, Mr. Charlie, for being here. I've got a couple high-level questions and a couple specific ones. Obviously, you've shared that you've appropriated, programmed, and did this money that was from CDA to SLDC. Is it because it took time programming it it looks like there's such a low percentage of what's being expended. So why?
So these are all new programs. So I think we want to start there is that, these are all brand new programs that are established by the city, by SLDC. So these are not programs that already existed, that we're just putting dollars into things that, we've always done. This is our opportunity through the American Rescue Plan Act to really start to move the needle on initiatives and programs that have sat dormant for too long, specifically supporting small businesses, contractors and suppliers. Again, the small business grants in North City, being able to establish the Northside Economic Empowerment Center, acquiring the workforce facility on MLK. These things are all new and they take time to establish. But then also we had to work through programming and ensuring that every one of the programs that we established meet the Treasury guidelines. So as we are dispersing and expending these dollars, we're not clawing back dollars that do not go towards eligible or qualified uses. In addition, we are partnering with CDA to ensure that, we are, again, following HUD guidelines, following Treasury guidelines, establishing those subrecipient agreements between CDA and SLDC to determine the outputs for every program, and then identifying the process for SLDC to actually implement and start to expand those resources. That's also required us to hire additional personnel, train that personnel, and then start to run the program itself. So that's why I'm really excited about the next 6 months, that we're fully staffed at this point to be able to start expending these dollars. We've programmed these dollars, and we will see a significant acceleration of these programs over the next 6 months, now that we have the staff, the legal documents in order, and also the financial capacity for Charlie to start processing these grants and loans. Because as you can imagine, with hundreds of grants that we have to process, we have hundreds of applications and hundreds of disbursements that need to be made to these businesses. So it takes time to establish that, ensure that we do it the proper way.
Great, thank you. Back to the not those funds, but your general budget. We obviously had Stacy Fowler and Lennox Lamb joined us yesterday at the Red Tape Committee, and minority and women-owned businesses are of concern, and we want to support them. And it also seems like there's a lot of work to do to support them. So my question is you've budgeted $45,000 more to support personnel in the capacity building. Is that enough?
So that's a start, I would say, to get us moving in the right direction. Initially, we funded $140,000 per year to the airport to support our our certification program for women and minority-owned business enterprises. We sent a letter late last week on informing them that we will be discontinuing that investment, so that $140,000 savings will actually go towards supporting the new certification team that we're building with SLDC. So that's why we've only asked for an additional $45,000, but also reducing that investment with the airport allows us to have resources to invest into other personnel as well to help with that certification process.
So thank you. And I've got a couple more questions related to the minority contract, and that helps. I was like, I think there's a lot of work to do, and that doesn't seem like a lot.
But it's another $140,000. We're looking at, we do anticipate $70,000 to remain in its current budget with the airport as it will, as the term of the way the fiscal year ends. So we still have WMBEs that are in the pipeline that we need to get cleared out before we start our process. And so the airport will maintain that work over the next really 90 days. So the $70,000 that we've allocated for the airport for this next fiscal year is to help complete that process and then roll that off to SLDC full time.
And then you'll essentially take it in-house.
Yes, exactly.
So back focused on the minority or the workforce compliance monitoring, which is, I believe that software also monitors the rates and levels of, or the utilization, I guess, for the MB.
That's correct.
Weebies. It looks like you increased and then it's decreasing in fiscal for 25, or I guess it's up.
It's up $17,000.
Can you just tell us a little bit more about that?
Yeah, so it's our Trino and head count software that we will be utilizing and embedding across all of our city incentivized projects. So any project over $1 million at this time. I know the current legislation that's being proposed, but this will provide us with the software to go out and monitor these projects in an ongoing manner. And so that's what that line item is about, is Trino and for head count.
Okay, and then final question, at least for now, is I think one of the things that generally across city departments that we're hearing is, making sure that we're in compliance with the Sunshine Law and transparency and posting the required materials. So I guess in the budget, are you all shifting any more additional resources to make sure that that happens?
So we actually have the city councilor's office that supports us with those sunshine responses. We have David Meyer on our team representing the city councilor that responds to those sunshine requests. So we are continually paying into the city councilor's office from SLDC to support those efforts. But then also, if there are continuous and larger files that are anticipated to be shared, we do charge a fee for individuals or entities to actually request that information because it takes staff time. So we just ask that if there is an entity that's looking for a large package or batch of emails or documentation, that there will be a cost associated with that request in order to support the funding for the legal team to conduct that sunshine review.
Great. Well, that's all the questions I have. Thank you for answering them.
Alderwoman Saunier.
Thank you, Madam Chair.
I think that concludes her questions.
I dropped it because you used the word accountability and ownership, and I think I've been in a state of shock since. So personally, I just want to thank you because I think I like whenever leaders lead and when we show nothing's perfect, especially right now. We're creating a lot of things from scratch. A lot of processes are outdated, and I think sometimes it's easier for us to kind of point to everything else, but just kind of saying hey, this is a new process. We're learning as we go. We're trial and error. And I apologize for our end. So first, I just want to commend you for that.
Thank you.
You're welcome. And just say I think you're doing an excellent job. I love all of your updates. I know that I bother you and your staff pretty often, and you guys are always responsive. I wanted to make sure that I acknowledge the town halls that you're taking the time to do throughout the community. I think that's amazing. I think a lot of folks in communities have a lot of questions about development and projects that are happening, but it can be very nuanced. The language can feel like jargon. It can be above folks. So I really appreciate you taking the time to go to those town halls, create the spaces for those town halls, host them, and explain to folks what's going on. I guess the thing that I really have a question about or would like to hear you speak more about is something that I know all of my colleagues are probably very familiar with, but I just wanted to really talk about large-scale vacancy and the city's options towards them. Most specifically, like in the 7th, we have St. Alexis Hospital, and it's been a complete nightmare. There are things that are happening, but I think there's a lot of constituents in the community who, while we go through legal and judicial processes, they're just very frustrated because they have to live with the public safety and public health hazards that are happening. So I would just love to talk more about what those options are, what those processes are like.
Yeah, so one of the things that, again, first, thank you, Alderwoman Saunier, for your remarks, and appreciate your partnership in the town halls and the legal assistant and being able to support us on those efforts. Is, as we talk about LCRA, and I know been a revamp of the tax incentive policy, but one of the areas that we're looking to improve through the town halls and through the neighborhood transformation management is to ensure that our neighborhoods and our residents and our businesses that are currently in these areas are educated on the tools they have at their disposal. And I think one example of that is through the leadership of Alderman Aldridge and the JVL and St. Place neighborhoods when they moved forward their redevelopment plan to address the 800 plus acres of blight that they currently have and how to move forward on removing that blight, right, in a more effective manner to support those residents. And I think taking a similar approach is, as you have your town hall meetings or your community meetings, inviting Zach Wilson, our VP of Incentives, to those meetings so he can have conversations about, how can we establish a redevelopment plan for a particular project? How do we blight a particular project, get the blighting study done, and then bring the necessary incentives, whether it's funding from the city or, most importantly, tax incentives from the city to actually drive development there. And through that process, we can actually establish a RFP that's based on what the community wants to see, that already has those incentives attached, that makes it attractive for developers to come in and redevelop these parcels. So that's, I think, one area in which we can definitely engage with you on, Alderwoman Sanye, and other alders that have projects that are in particular disarray or disrepair that we want to maintain and manage, and working together on addressing that vacancy and dilapidation.
Thank you. And I know we're currently in communication about exploring those next steps.
Yes.
I have a town hall tomorrow, so no pressure, but I'll see if somebody can make it, because it's actually going to be in Gravois Park, focused on vacancy. And I know this will be something that comes up. So if not him, I'll see if maybe we can I know the neighborhood manager, I'll see if we can maybe get someone there for sure.
If not, then definitely have either Zach or someone from his team to join, to start having those conversations, those meetings, and then we can engage with the appropriate parties, because we have partnerships and funding that we've provided to Legal Services of Eastern Missouri, as an example. They're a community organization that have supported neighborhoods on drafting those redevelopment plans. And in many cases, they provide pro bono services for those neighborhoods. So, that's one way to leverage us and funding that comes from the city to support Legal Services of Eastern Missouri.
Excellent. My other question is about the Nexus study that you guys are working on. If you want to explain what that is for folks who are listening. And I know I bother you about it every now and then, so I'm just bothering you again about it right now.
Yeah, no, for sure. So we just received the first draft of the Nexus study late last week. And what the Nexus study does is show the intersection between tax incentives and the impact on the school district. What the Nexus study does is show if we provide a tax incentive, not just how that impacts the tax district itself, the school district, but also how it actually creates more revenue for the school day one, but then also how it provides greater access to affordable housing and also other amenities to keep residents in place. Because one of the greatest areas of revenue, as you know, as a former SLPS board of director, is the revenue that comes from the actual youth and children and students being in the classroom. Mm-hmm. And so our goal is to ensure that we're attracting development that actually keep our residents here and not continue to see the exodus and the continuous decline in our population. So our goal through the Nexus study is to show the right level of incentive or investment that can come from the LCRA or the other taxing bodies to support the schools, and ensuring that we understand that there is a balance that we need to have between the projects that get incentivized and how we support the ongoing growth of SLPS itself. So as we review that draft this week, we'll definitely follow up with the Board of Aldermen with those results. So we're excited to start having those conversations.
Excellent. The other thing I want to ask you about, this might be a little bit, you may not be able to answer this, so that's okay. But I know one of the things that cities all across the country are talking about, it was flagged for us in a previous budget meeting about the expenditure of ARPA funds, timeline being tight. Do you know, do you maybe have any information that could be shared on conversations, I guess? I know this is a plan to get it out, but do you know if we've had any conversations, maybe from the administration, about applying for an extension of deadline to release funds, or is the plan just to try to get all of this out? I'm just curious.
Yeah, so for SODC, we have 100% of our appropriation program, and we anticipate having no issue with funding 100% of these by September 30th of 2026. We will continue to revisit these programs and the expenditures. But the reason why it took us longer to program it is because we wanted to ensure that we were able to get these dollars fully expended before 2026, and that these dollars we're not have to send any funds back to CDA or to U.S. Treasury. So from SODC's vantage point, we are planning to be 100% funded before September of 2026.
Okay, and this is my last question. But we also got a cool presentation from Dr. Sandoval from St. Louis University. I think one of the things I'm really passionate about and concerned about is always families and kids. Like you said, I was on the board of education. I just think if a city doesn't have youth and it doesn't have families, then a city, it dies, you know? And I think one of the things that is really difficult is a lot of times when people want to start families, and if they're looking for affordable family housing within our city, it's extremely difficult. You know, I can speak in reference to my ward, but you're lucky if you can find a $250,000 home for yourself and maybe a child or two. So I'm just curious, have there been any conversations, or is the city doing, especially as we think about population and think about tax decreasing and thinking about, you know, a teacher who starts a family that may go out to the county because I can find a $100,000 home for myself and my family. Is the city or is SODC thinking of things we can do from a developmental wise to drive massive like production of affordable family housing, homes, different structures, and I do mean family and affordable?
Yeah, so that's two of the goals that we have. Two of the programs that we have listed here address those exactly. So first is the home ownership fund. So the plan is for us to, you know, to target 80% AMI or below. Usually that falls around those teachers and firefighters, public service employees that can qualify for these programs, and to create this really as a pilot. Again, that $4 million will support approximately, you know, 80 families. But if we're able to then go out and show the outcomes to the philanthropic community, to the private sector, they can help double down and leverage that up. And that's our goal, is to be able to make it affordable for homeowners to be able to purchase these houses. So when they see a house for $250,000, this $50,000 of home buyer assistance that we provide them allows the mortgage to be dropped down at a level in which they're not paying more than 30% of their income on housing. And when we talk about affordability of housing, that's our goal and our target, is to ensure that no family is paying more than 30% of their monthly income on housing costs, because then that becomes a burden on them to be able to manage other expenses such as childcare, prescriptions and pharmacy, as well as groceries and those other things they need in order to have a quality of life. And that's our goal through that home buyer assistance program. We also need to subsidize the housing development itself, because construction costs is extremely high right now. We have units, and I was talking to a developer yesterday, LaTeX units that cost on average for a 2-bedroom, 1.5 bath, almost $300,000 per unit to develop. And so as you're thinking about how do they make it affordable, how do they make it financed, we can't rely solely on LaTeX credits. We have to bring other incentives and other funding to the table to make it more affordable. And that's when the public sector has to step in and not develop those low-income housing units in our challenging areas. How do we ensure that we create mixed income neighborhoods, that individuals that are at 30% AMI are living next to somebody that's at market rate, and now they have the same access to the amenities, services, school, education, infrastructure to be able to achieve economic mobility. And that's our goal, but we have to think through other resources outside of just the low-income housing tax credit, such as tax incentives and other grant programs that we can bring to bear, such as what we're doing with the Citywide Housing Development Fund. But that's a small piece to the gap that we need to fill in this region.
Okay, and don't yell at me, committee. I promise this is my last question. But you mentioned, okay, you and I have had some experiences and some conversations with developers in the community, and most of those conversations go well, but I think one of the things that has come up, and I think a part of the scorecard, was to start to kind of create uniform expectations across the board. And sometimes it can be a challenge when your community may want to explore with a public benefits agreement or something like that, but that's something that developers may not have been familiar with or wasn't a requirement in other communities. But at the same time, I think in my opinion, I think that you have to be very aware of your community and what you represent. And if you don't have certain standards in places where it is a hot spot for development, then you're kind of de-incentivizing people to go to other areas in the city that really need the development. And so I found myself in that position quite a bit. Like I said, as you know, most of the conversations go well, but sometimes people just want you to be grateful that they're just doing anything in the city of St. Louis, and they don't want to even talk about what it might look like to make it mixed income or whatever. So is there any conversations around, and I can't say community benefits because community benefits would be from the community. So in this way, it would be like a public benefits agreement, but around creating like standards for that or something like that that might be more like uniform and not necessarily on individual alders to negotiate with the developer?
Yeah, so that was the purpose of the community benefit scorecard, was to start that process of creating a framework for how to score projects, but also recognizing that that's going to evolve over time. And that's, again, as we've engaged Alderwoman Velasquez on how do we update that process, remove that red tape. We have members from SLDC that's part of the Red Tape Commission to ensure that we are working in tandem with the city as you all are moving policies forward, that we can be on the front end and help shaping that, to not create more barriers, but to create some consistency and to provide the perspective that the developer may have and that pushback they may have. So then we can solve for those things now, rather than you all having to solve for them as individual alders in your particular wards. We can create a more uniform approach that once we have a negotiated, term on the incentive and a community benefit that can be delivered for every project, that we can move directly into getting that approved. I think what the challenge is right now is, we still have some specific desires from areas of the city that need to be met, and trying to create a uniform approach that supports all of the city is going to be our challenge over the next, I would say, the next session or two. But we're partnering closely, SLDC is, with the Red Tape Commission and other members of the HUD's committee to ensure that we create a uniform and holistic process that works for the city.
Okay, so what I hear you saying is stay in conversation and we can talk about some possible policy around it.
Yes, so we're in the policy discussion. I think that's where I appreciate the feedback from the the Board of Alders, as well as specific aldermen that sit here today, around how we can be involved up front in the policy decisions. And it's not for us to guide policy, it's just to provide you with feedback on how we believe it can be implemented based on the spirit of what you all are aiming to achieve, and how we can work collectively and collaboratively to support economic development in the city. Because our goal is not to hinder development, but it's to ensure that it's more equitable. And so that's the lens that we bring to the work.
Collective and collaborative. Oh, I like those words.
Thank you.
Thank you.
All right, thank you.
Alderman Aldridge.
Thank you. Is it CEO?
Yeah, that's fine.
CEO, director, president, black man, this is for being here today. I'll keep it short. Being at the tail end, sometimes after you hear them all speak, you be like, Jesus. I'm like Pam. I'm confused what I'm about to say. But no, thank you for being here. Also, I want to appreciate you're not recognized. Appreciate your time and your team time for being here, but just the work that you're doing for the city. A couple of things that you had talked about. I know you, like you say, participating with the Red Tape, and as Alderwoman Sonia brought up, community benefits. I appreciate how you have been. And I know there's legislation moving around community benefits, that all looks different for different development, is bigger than others. And even the development bill we did with the JVL and St. Louis Place, how SLDC actually took the input of the community in all those recommendations, just 110% of it, be a model for the rest of the city. Two questions on the neighborhood beautification. Right now, you say that it's just the mowing of some lots in St. Louis Place and JVL?
Yeah, and it's also the removal of some debris. So as I'm sure you're aware, especially in your ward, Alderman Aldridge, there's, trash, sometimes old tires and those sort of things need to be removed from the yard before the grass cutting can even begin, or old fences and those sort of things. So that's part of the beautification program is not just cutting the grass and making sure that we come back and cut it and keep it low. It's also making sure that we remove that debris from those properties as well to help support the beautification of those communities and neighborhoods. But we're just starting this program and looking to expand it into other neighborhoods over the coming months. And then you'll see ongoing cuts and debris removal happening through this program through the end of 2026. And then hopefully we are able to show progress, and then we'll get more support from the Board of Aldermen on funding to keep it going.
Well, as long as you got at least the 3 on ENA, you have a good start. We just listen at this committee. But so those lots that I guess y'all taking care of, will those be out? Those are outside of forestry, correct?
Those are outside of forestry, that's correct.
So me and you could talk off record, but is it possible to get those lots? Because then I know not to maybe contact forestry, and then if those are in the, okay.
Yeah, we'll share that with you. Yep.
Okay, and then the next one, just as far as probably communication, I think could be helpful. I agree with Alderwoman Boyd, and some of these I probably could just reach out. But if there's any way when it comes to the North Side Business Corridor grant, that either that timeline can be probably shared to the alders that have the wards up north, or what businesses are awarded it, because I know I've gotten plenty of calls and I just reference and say, that's a SLDC thing. It's not, the board it's out of our hands now since the board bill was done. But anyway, I think that there can just, like I say, be information we could share with residents if they got awarded or if they didn't, or a timeline of what they should expect. I think that may be helpful because I've been getting some calls on like where it is in the stage, and the information you provided today was helpful to take back to them.
Yeah, no, understood. So we'll share that timeline and then also beautification program details with you, so you can have that information to disperse to your team. We've also updated our developstlouis.org website with the latest North City grant program details. So we actually have a landing page that shows the timeline and also shows the amount of money that we dispersed. We are not able to share the specific businesses that applied for the program until awards are announced, because we're still making those decisions, obviously, and we don't want any interference from outside parties into who's getting selected for that. But we'll definitely share that list and the funding requested amount for each business following the conclusion of the program.
And I know this, like you say, this is kind of the first time, so I know there's going to be some hiccups and like hurdles and making sure you got staff. So I'm sure your department is, working diligently to try to get it across. Once everything is finished and folks are awarded, maybe cool to just like have if not per business, but like a graph of like what wards and stuff like that. So
yeah, for sure. And I believe we shared the per ward application, and I can make sure that's shared again, because we were able to break it down per ward, but not just sharing a specific business name and information. So we'll be sure to share that as well. I'll take note.
Okay.
Share that per ward. And then we'll have a map similar to what we did with the small business grant program that was for the entire city. We had a map to kind of show the neighborhoods, the businesses, and the amount that was funded per neighborhood.
Gotcha. And I don't know what this Nexus, I don't know what the Nexus report is, but whatever that is, I asked Alderwoman so she could explain it. Sounds like tax abatements and stuff. But I did want to just bring up, I think one thing, whatever the report is, please share with me. One thing I'm glad that you brought up, because I think is this notion, and I dealt with it during some legislation we worked on as far as the difference between tax abatements and TIFs, and how tax abatements actually can help generate money for our public schools. There is this notion that if you do a tax abatement, which I looked at, got to give a plug to President Green, her end of session report of how tax abatements are, I think, probably like 50% down from several years. This last board has done very little tax abatements, but from the reports that you guys provide to us when we do a bill, it indicates how much money actually goes back to public schools on the front end, especially if that development like never happened. So as we are on record and people watching, I just appreciate you highlighting that tax abatements actually can be helpful to our public schools, and not all tax abatements hurt SLPS and public schools.
Yeah, exactly. So one of the first things that I did under my administration was to ensure that we no longer provide 100% tax abatement. So we ensure that day one, the projects actually contribute to the tax base. We've also implemented more projects that have a sliding scale that goes down over a period of time, because what the tax abatement does, it does not give additional revenue to a developer. What it does is decrease the operating expenses on that project to allow them to receive financing, because sometimes the additional tax revenue, that the tax costs that are associated with the new project actually puts them in the red. And we want to ensure that these projects are actually able to move forward, but they're not over incentivized. So we make sure that we do that but-for analysis. But then also, one other thing I want to ensure that the board and the public understands. When we provide a tax incentive, we also are ensuring that our WMBE, prevailing wage, all of those other community benefits are included in these projects. So if they don't use the tax incentive, then they're not required to pay prevailing wage. They don't have a requirement for WMBE. So those are benefits of having the tax incentive. But then also looking at the highest and best use of those parcels. I think we have to also look at what is the highest quality of product that we want to put on these parcels that are considered blighted. And yes, sometimes, we want to see a high-end project that has mixed income associated with it. And I think we get pushback around, should we be incentivizing those projects? We can still redevelop that site, but it won't be the highest quality. And that's when you end up with, less appealing investments, such as a gas station or things that you don't want to see in a community, because that parcel only works for its highest and best use with the tax incentive. So we have to look at this as a long-term investment as well in our city and the amenities that we offer. If we don't offer these incentives, we're kind of left to the free market of what they believe they can actually get financially done there. I like to talk about this, and I talked about this at the town hall last night, is it costs the same amount to construct and build projects in the city of St. Louis as it does in Clayton. However, the amount of rent that we're able to attract for these lease rates are much lower right now in the city than they are in Clayton, because we need to improve our infrastructure, because we need to improve our schools, because we need to improve these things. And so being able to attract these investments, leveraging these incentives, it allows us to put more revenue towards the schools, put more revenue towards infrastructure, that then keeps people in place, that ultimately raises our tax base and raises the values of these properties, that then begin to see a decline in the total amount of incentives, because now these projects are able to get and command lease rates or sale rates that actually are able to be financed without public subsidy. But in this current moment, unfortunately, we are not there at the city. So these initial investments that we're making in the form of tax incentives allows us to attract development that, one, contributes day one to our revenue, but then two, supports the overall growth of our entire city. So we need to be focused on how do we attract that development and make these investments in the short time period so we can compete long-term as a city against, again, other regional, national, and even international locations that are seeking to attract these businesses. So that's, again, a lens that we have to consider, as well as the equity. So that's kind of what SLDC is focused on, is looking at all of those measures and making sure that we are being responsive and competitive.
Yeah. Well, thank you for that education. I think as you spoke, something that's also very important that could be helpful for this board, but also people at the public. When folks go out for a tax abatement, that's not like they just get the abatement immediately. They have to be in compliance. SLDC do regular reportings, check-ins, and one of the things actually that was passed at this board under previous alderperson was prevailing wage, and they have to be MBE and meet those MWBE requirements. So those are requirements that they probably can get the board bill passed here, But if they don't meet those requirements, they will not end up getting a tax abatement on the back end. So, and I know we've been in conversations that y'all are working, harder and harder to make sure that these developers are actually being in compliant when it comes to prevailing wage and making sure that minorities are included on these projects.
Yeah, that's correct. And so we've beefed up our minority and women compliance team on these projects through the construction phase. But we also added a monitor on the back end because they also, through the redevelopment agreement, the developers themselves agree to meet the terms of the community benefit scorecard. So we have a monitor that actually receives annual reporting from each of the projects to ensure that they're meeting those goals established in that community benefit scorecard. So we have someone monitoring that as well. And so as you see the increase again in our personnel costs and the costs associated with SODC doing compliance monitoring and our certification support, it's important for us to understand that this is the work that we do. This is, the things that we take for granted. It takes people to actually move them forward, and it costs to bring those people on board. So I think that is a very apt conversation and topic for this board today.
Yeah. Well, I'm gonna wrap it up, but I appreciate it, and I think again, the work that y'all doing is essential. I appreciate how y'all being intentional. I know it's not just you, director, president, CEO, black man. It's also the mayor who's, looking at how we look at areas in North St. Louis that hasn't been invested in for a very long time, like Dr. King being looked at other locations. And when we do these type of developments, I know just in my short time of a year, we had some hurdle of projects where some hurdles, but I learned a lot. And I think it's, again, not just important for me as a new member, for other members of the board, but also the public to know about how these processes work and how your office is really taking a holistic approach and not just giving away tax abatements. We don't even think we done a TIF this last year, but we're not giving away like candy and being very intentional of how much money goes back to public schools, the prevailing wage, the minority men and women that are on the job site, and how those all are part of transportation lines, right? How those are all part of the scorecard. And I appreciate it, and you're always willing to listen and take in input from the board alderman. So thank you.
Thank you.
I want to flip it back over to Alderman Velazquez. Do you have another question? Okay. Mr. Richardson, thank you for being here today. I know we're already at time.
Okay.
I wanted to commend kind of the reduction in funding to the consultants. I know, as you mentioned, an ex officio member of the SLDC board, that's been an issue I've brought up several times, and I appreciate the sort of focus on that. SLDC is a separately funded entity, as you mentioned on the front end of your presentation here, a 501 or a 501c4,
C4,
which is fairly unusual. I mean, I think typically speaking, development agencies are typically funded within the city. The SLDC receives no general fund, so our economic development portion of city government is funded outside of city government. So we're not actually funding that work, which creates a bit of an interesting relationship with the city. There's pluses and minuses to that, but I also want to uplift the alderwoman from the 7th, in regards to St. Alexius Hospital. When I represented that district or that portion of the city, it's a topic you and I discussed fairly frequently. I think it's really, really important to look at that enormous vacancy for the blight that it is, but also for the potential that it also represents. The further degradation of it really, I think it poses a big threat to the surrounding community and the surrounding business districts that are fairly stable at this time. So anything we can do to help, please let us know. I will reserve the remaining questions, thoughts I have for our board meeting.
Okay.
With that, I'll entertain a motion to adjourn.
So moved.
Second? Great. Hearing no objection, that concludes the Budget and Public Employees Committee.
Yeah.
Thank you.